in my practice, what I've been seeing is that as people get older, they're on more medications. And the more medications they're on, and the more specialists they see without one doctor taking any kind of responsibility. I just recently had a dear friend of mine being seen at University Hospital. He was being seen by a neurologist, a gastroenterologist, an internist, a cardiologist, a psychiatrist, a dermatologist, and maybe a few others. And over 8 months, they never came to any kind of conclusion of what was wrong with him. There must have been 37 tests, and no one knew what was going on. And his symptoms were, and relating to what you were just saying, he was woozy, lightheaded, not dizzy, but woozy. He was constipated, he was depressed and had anxiety. He was on 2 blood pressure medications, Norvasc and Losartan. He was on Lipitor. He wasn't sleeping well, so he took Xanax. And then they decided he was anxious, so they put him on Lexapro. And everything he went on made him worse. And we were playing tennis, or trying to play tennis. He was too woozy. And I said to him, "Lenny, stop. I want you to see one person. And if I could have gotten him to you, that's what I would have done. Because you make sense." So I got him to an internist cardiologist who's a patient of mine. And I called him and I said, "Listen, I'm sending you a friend of mine. So put your thinking cap on, because for the last 8-9 months, he's been seen by 7 or 8 practitioners of different specialties, and no one's come up with anything. And if you don't find it, since you're a patient of mine, I'm going to hurt you." Anyway, the first visit, and this is shocking, he took his blood pressure sitting down, and it was 160. He took his blood pressure standing up, and it was 106. So he had orthostatic hypotension. And from then on, there was a balancing and taking off and doubling and removing. And right now, he's on no blood pressure medication. His blood pressure goes crazy. It could be 200 over 110, or it could be 129 over 70. And he's anxious. And as you say, the brain controls the function of the heart. And they took him off the blood pressure medication, and he isn't lightheaded anymore. So one of my questions to you was, what the hell is going on here? But another patient came in, and we had to do a little crown preparation on one tooth, and I did. And all I did was go near the tissue, and he started bleeding. And I knew his history. He had lymphoma, and his platelet count had plummeted from a normal of 150 down to 90, down to 70, down to 25, down to 18. And I said to him, "Are you taking anything that would cause this bleeding to continue?" Because he was bleeding. We were trying to stop everything. It was a minimal procedure. And he said, "Well, every morning my internist told me to take an aspirin." So here we have an oncologist treating him for lymphoma, and the internist is giving him aspirin, and he has no platelets. And it's scary. It's very scary. So what I really want to bring up from this is that each one of us here is probably on medications, maybe 2, maybe 4, maybe 10. I mean, every patient that comes in that's over 70 is on 11 medications. And That's the good news. No, so what I just wanted to mention is that just because you're on a medication doesn't mean you stay on the medication all your life. You have to be proactive, speak to your doctor, and find out whether you still need all these medications or they have to be, the dosages have to be changed. I remember when I was in dental school, a man came into the school and he was the color of your coat. He had gone to his GP complaining of a sore throat, and they told him that he should swab his throat with gentian violet and it will get rid of the infection. And he continued doing it for 25, 30 years. And the salts deposited in his skin, and he was totally gray-blue. And people don't stop. They take a medication and they think this is it. And I think we really have to be careful about the medication we're taking and what its side effects are with other medications we're taking. So just be careful, speak to your doctor, and don't just go on automatic. So thank you for giving me the extra time. Let me see, I just want to grab. So getting back to dentistry and the implications on our health, when you go into a dentist's office, there should be a time spent together where he gets to know your history, the medications you're on, who you see, which specialists you see. Do you have a pacemaker? Do you have a defibrillator? Do you have any stents in your heart? Are you on blood thinners? Are you on any blood pressure medications? Do you have any valve problems? Have you had tachycardia, fibrillation? Do you have diabetes? When you stand up from a sitting position, do you get dizzy, which would indicate, as we said before, an orthostatic hypotension? The other thing, a side effect from all the medications we're on, something like 90% of the medications given will cause dry mouth, lack of saliva. And one of the biggest problems I face is that as people are aging and they're on more medications, the constant complaint is dry mouth. And besides being a complaint, what essentially happens is with a lack of saliva, people tend to either suck on sugar candies or Tic Tacs or anything that would relieve this dryness with their cheeks sticking to their teeth or their tongue. And as a consequence, we see rampant decay, different decay than you would see in a teenager. In a teenager, they get decay between the teeth at the contact point. In elderly people who have dry mouth, what happens is you get circumferential decay around the gum line, eating away the enamel and causing absolutely colossal, insoluble problems. And you have a person 70, 80, and their teeth are rotting. They don't want to come to your office often. Some of them will have such decay they'll need endo, root canal, or teeth extracted, implants placed, and they're not in a position financially or physically to go through that much work. And a lot of them are on blood thinners due to atrial fibrillation or due to some other problem. And they can't easily have surgery or go off these medications. People that have stents placed have to be on these blood thinners for at least a year. People that have prosthetic hips or knees have to be on blood thinners. So the rampant decay in elderly people is, to me, the most frustrating, depressing, and almost insoluble in many cases. And it's really a very saddening event. Then there are allergies that people may have, and this should be discussed with them. Also, over the years, when you're looking at a patient, if you're doing your job as a dentist, you shouldn't be looking at their mouth and their teeth only. You can get a lot of information by looking at the color of the skin, the presence or absence of pallor, the eyes, whether the eyes are clear, whether the lips are pink or pale, whether the eyelids are pink or pale. If you look at their skin, their arms, their legs, if you look at their ankles and you see swelling, a lot of things should be noted and brought to the attention of the physician she's seeing in case he hasn't noticed this. The other thing we have to be aware of, and you should be aware of it, I think, we should have heart monitors at home. And not that you should do it every day, but I think it's important to monitor what's going on in your body. And if you see very volatile changes in your blood pressure, the systolic, the diastolic, I think it should be noted and reported. The other thing you should be doing if you have any heart condition, or even generally, is to weigh yourself and be aware of any sudden weight gain. Because if you're gaining 2.5, 3 pounds a day, you're not eating that much. It's usually due to water retention. And whether you're on a diuretic or you're not on a diuretic, it's important to report to the physician who's treating you. I remember a patient came in, 37 years of age, losing all the bone around her teeth. They were all mobile, and I looked at her, and her lips were very pale. They weren't a normal pink color. Her eyelids were very pale. She had a crusting in the corner of her eyes. She had a rash on her arms and legs, and she just seemed ill. And I suggested to her that she go to an internist and have a series of blood tests done, because I felt there was something going on here that I couldn't deal with dentally. I thought there was probably some kind of a blood disease or a bone disease, and she went to an internist, had all these tests done, and about a week later he called me and said, "She's fine, just take care of her teeth." And I said, "She can't be fine. Did you look at her?" And he said, "No, she's fine." So the husband called up, screamed at me for costing him $800 for all these tests, and that she's fine. 5 weeks later, she collapsed in a shopping mall in Jersey, and they took her to a hospital in Teaneck. And they found she had a blood disease and a bone disease. Now, how this didn't show up on the tests, I have no idea. But she was found to have Gaucher's disease and hemolytic anemia. And Gaucher's is a genetic thing. I think that she's had that all her life, probably. And now the husband got off my case and wanted to sue the internist. Anyway, so it's important to make an observation when people come in of their entire being, the whole corpus, not just looking at the pearly whites and the gingival tissue. Now, you also have to find out what the history is with regard to basically infective endocarditis or rheumatic fever, and you have to know what the history is of diseases with these people, because some of them have to be pre-medicated even if the risk is low, and you have to be aware of this. whether they have mitral valves, prolapse, I don't know. Are they still pre-medicating? A lot of my patients have prolapsed mitral valves, and they say they don't have to take antibiotics anymore. Is that
There's
true?
a specialist, Dr. Nagavi.
It's basically the requirements or the guidelines have gone down because of the incidence of endocarditis, but still you have to assess the individual risk and not just brush everybody with the same stroke.
Right. Now, basically, as Dr. Nagi was saying, I think something like over 50% of the deaths in this country are based on some heart failure or heart disease. And it's very important to make sure that you're following a schedule of treatment. And again, you know, diabetes is a link to heart disease. Lack of exercise is a link to heart disease. Alcohol is a link to heart disease. And so we have to keep these things in place. Excess weight is another heart link. High cholesterol, high triglycerides is also a risk. A low HDL, poor diet, and genetics, which unfortunately we have no control over. Now, if a patient comes in and we examine them, some of the things that we'll see in the mouth relative to people in ill health or heart disease would be a poor periodontal condition. The gingival tissues could be bleeding, swollen. Many cardiac medications cause, like Norvasc, could cause a gingival swelling, a gingival hypertrophy. And you have to be aware that this could be caused by local factors or by the medication. As I said, a lot of medications cause dry mouth, and we have to be meticulous in our home care and the foods we select, because we will have a diminution in salivary flow as we get older. The other thing we have to be aware of, and was mentioned before, is you have a patient in the chair for an hour, and they stand up and they get woozy, or they may faint or collapse. And these are people who are unable to reestablish proper flow due to the heart contraction due to a postural change. And it's very important in all of us that when we are sleeping and we wake up and we sit up, we should sit for a few seconds before we stand. And after you stand for a few seconds, let your pressure reestablish itself. I've had a few people who had this problem, and I counseled them as to what to do. And neither one of them listened. And jumping out of a car and running from a plane, or jumping out of a restaurant and running to catch a bus, they fell, hit their heads, and died. And they were both on anticoagulants. So, I think that's about all I want to go into right now. So, any questions, or we're going to wait till later?
We'll do it later.
Yeah. But I wanted to ask you about